Thank you very much. Thanks everybody for being here.
Hi, good morning. My name is Gina Stone. And first thing, I wanted to thank everyone for being here today. Incredibly busy time, unprecedented. But I do think that this conversation that we're having is super important, especially with the new development of the pandemic that we're dealing with today. And I'm the chair for PHAB, and I've been sort of being the link between the task force with the health board. And so that's kind of my function. My role. PHAB is for Public Health Advisory Board. We are a group of people that is there to kind of help the health board with the direction of the health of our community. I'm going to stop there, but I just want to recognize one of our council member, Carol Frazee. She's here today. And Carol, do you want to just say a couple of words before we get completely started?
Sure. I'll put on my video, even though I just came back from a run. Oh, there we go. So I just appreciate all the work that you've been doing, and the Safer, Stronger Together. I think I got that right. I'm not sure what you put together for that. And I think the more communication we can get out and how you're working with that, you're doing a great job. So thank you.
And I'm going to throw it back to Elizabeth.
I think it's Holly. Are you ready to?
Yeah, I sure am.
Perfect. Thank you.
Big way. So just to introduce, so Elizabeth, Laura, who started us off, Marty and I are the facilitator team who've been working on this project for the last couple months. And I'm Holly O'Neill. I am a resident of East Whatcom County. So I'm dialing in here from the South Fork Nooksack Valley, and I'm going to give a little bit of background on why we're here today and what we hope to achieve. And I just want to thank you all for being here. I know everybody's trying to split on vacation, so we are so honored by your presence today. So I'm going to do a little slideshow here, and it'll be quick, don't worry. I've been reading about Zoom fatigue, by the way, so if you want to close your eyes at any moment, that's fine. But I am going to host disabled attendee. Laura, could you turn on the screen share option for me? Pretty
that
please.
Would be Marty.
On top.
Yeah.
Or Marty, dear. It started. Okay, so you need to let me share my screen.
Sorry.
There you go. All good. Okay, let's try this again. So you want to
hang on.
Yep. One of the things we've all learned during the pandemic is an incredible level of patience. Just patience
with my lack of techno abilities.
You know, who would have thought we'd ever be here having to learn things we never wanted to learn? Okay, I'm going to start us off with a little overview. So today we're going to talk about how to connect with our younger employees about COVID-19. And this is this conversation, we're not going to offer so much like rules or you know, it's not. This is the opening. I would say the beginning of an exploration about how we have these conversations, because they're not very easy to have these conversations, and we're going to listen today to why they're challenging. I'm going to set the stage, and then we have an amazing panel for you to share their experience in talking to younger employees. We'll have a little discussion for the whole group, and we'll wrap it up. So that's the plan. And if we go a full hour and a half, that's great. If not, you know, we'll wrap it up faster. So to give a little background, the Employer Support Task Force was recommended by the Public Health Advisory Board, and that's Gina Stone who started us up. They recommended that we move forward in terms of having a conversation about how we can start working together to help our community's businesses and organizations share, innovate, and improve best practices for safety in the face of COVID-19 now and in the future. And as we're seeing, the future continues to roll along. So this is not a regulatory process. It's a process of helping each other out. That's the goal. We ended up with 140 members on this task force, and they were divided into 18 sectors, and they've been meeting for the last couple months to share like how do we understand this guidance, and how do we put it into practice, and where are we getting stuck, and how do we share tools with each other. So we're just at the culmination of that process, and soon we're going to be able to share out, and that's happening, spoiler alert, on August 13th. One of the outcomes of this process has been the creation of the Safer, Stronger Together campaign. So that's providing signage and messaging for all of the businesses and organizations in Whatcom County to be able to communicate with their customers, and really to provide backup for our employees when they're at that interface with the customer or the client and needing to have a conversation, and knowing that they have the support and the authority of the health department behind them, and the support of the Regional Economic Partnership and others who are working to communicating clearly, this is how we're going to operate safely. If you go to the website, which is also this, whatcomtogether.org, it also has a link directly to the Whatcom County Health Department web page that was created for this effort. And you can click, if you think about these two websites, they click back and forth really easily. And this is where you can find the actual guidance that we're trying to make it as simple and accessible and straightforward. So in this mass of information that we are dealing with, that you can go to the health department website and you can just find what you need. So, and it's kept up to date. So this is a great resource, and hats off again to the health department for all the work they're putting into this, because things change so quickly. It's a lot of work to stay up to date. Okay, so that's the basic framework for today. And now I am going to turn it over to the lovely Elizabeth Boyle, who is going to moderate our panel and is also our campaign coordinator for the Safer, Stronger Together campaign. So Elizabeth, I'll turn this over to you.
Hi, everybody. So look at that great panel. We have an amazing group of experts with us today, and we're so grateful for all of you that were able to be here today to listen to them, and then we'll be using their wisdom and experience in the months to come to share with an even greater audience. So we're really grateful for all of you. Today's topic is about our youth, and how do we talk with them about their impact on what's happening, what their external social experiences are doing in our businesses, and how can we do that in a really graceful, engaging way and not a shameful way. So we'll be talking about experiences and tips from what people are already using in their businesses, and how can we bring those into our own. So we have a few people I want to introduce Cindy Hollingsworth first. She will be available for the Q&A at the end. But Cindy, I don't know you yet, but I keep hearing everyone refer to you as Queen. Can you just say a quick hello so people can hear the Queen Cindy speak?
Good morning. That's an introduction. Cindy Hollingsworth. I'm the Communicable Disease and Epidemiology Manager at the Whatcom County Health Department. So it's our team that is leading all the work around identifying cases and doing interviews with people who have COVID and finding their close contacts and making sure people have the resources they need to isolate and quarantine so we can stop the spread. So got a full team of nurses, public health nurses, and environmental health specialists and program specialists supporting the community behind the scenes.
Thank you so much to you and your entire team for all that you're doing to care for all of us. And thanks for being here too to answer questions as they show up in the Q&A area. So we're going to start today with Steve, and then each of our guests today. We're going to ask about 5-ish minutes to 7 minutes. But if you can first start and make sure you introduce yourself and what organization you're with, that would be really helpful. So I'll call on Steve first, and then we'll move to Danielle after Steve. So Steve, can I ask you to kick us off?
Sure. My name is Steve Bennett. I'm a professor of public health here at Western Washington University in our newly monikered public health program. It used to be referred to as community health. It's now a public health program. And I also serve on the Public Health Advisory Board, the PHAB, that Dr. Stone was referring to earlier as well. To start us off today, I'm going to speak in some just kind of health communication generalizations, as opposed to addressing the specific questions, as the specific questions are dealing much more with kind of how we're applying this in the real world. But I just wanted to talk a little bit about kind of why people engage in the behaviors that we want them to engage in and why they don't, and some of the theoretical frameworks behind that in a really simple, straightforward way. But generally speaking, when we talk about health behavior and engaging or changing behaviors, we talk about 3 ideas that can drive people's behavior. And these apply with youth as well. And I'll try to give some real world application to them as I talk about them. But the 3 big ideas we talk about are often opportunity, ability, and motivation in order to engage in behaviors. And those are the 3 things that when we're communicating with people, we really need to make sure that we're addressing. And I'll talk about them specifically quickly. So opportunity is just the idea of, do we have an environment that allows this person to engage in the behavior that we're asking of them? And I think generally right now, especially with mask wearing and things like that, we're setting up our environment to really provide the opportunity for people to engage in health behaviors. However, one of the things that we talk about within opportunity is something that we refer to as cost. And when we talk about cost, we're not necessarily talking about economic cost, but what am I giving up in any way in order to engage in your behavior? So comfort can be a cost, stigmatization can be a cost, embarrassment can be a cost. And I think that you'll find a lot of those start playing out when we're talking about youth. Because, we can tell people when there are employees, you have to wear a mask while you're at home. But then where is our line when we're then telling them, and when you're hanging out with your friends in your backyard, I also want you in a mask, and I want you to be 6 feet to 10 feet away from everyone else, even though you've been in a mask all day. And so we need to make sure when we're communicating these things that we are addressing that there is a cost to some of the behaviors that we're talking about. The second thing I was talking about was ability. So ability is where you're having the economical and psychological resources to behave in the manner that you're being asked to behave in. Currently, economically, I think most people have access to masks now, and we're working on making sure that masks are available and that people can access them. And again, here's where the psychological resources, I think, become really important with social distancing, especially with youth, where hanging out with friends, being able to talk with friends is really important emotionally. And being able to kind of have that contact. It's important for all of us, but we see it a lot within youth, especially if kids are at home, then they're not really able to engage the same way that adults are able to engage sometimes with their peer group. And so I think it's important for us to recognize that as well. And I think I've even had a lot of conversations when we talk about psychological resources about the exhaustion of masks. The idea of that you work an 8-hour day and you're wearing a mask, and the one thing you want to do when you leave work wearing a mask is to take it off and to just have a human conversation with someone where you don't have barriers between you and you can kind of really connect. And I think that we need to, when we're communicating with people, not just youth, but especially youth, is acknowledge that. I think when we dismiss the emotions that people have, and we dismiss the idea that these are real barriers to these types of behaviors, we often stymie any kind of engagement that we have with that group that we're talking to, because that group immediately feels like they're not being listened to or heard or respected in the process. And we all know that these are real barriers as well. But I think sometimes in our communication, we focus on a very binary aspect. You're either 100% compliant or you're a failure. And that's where we see the conversation happening a lot. And it's really hard for all of us, any of us, to be 100% compliant to any type of behavior at all times. There are a variety of stressors in our life that can force us to fail at times. But if we present these options in a binary of like 100% compliant or a failure, as soon as someone fails or feels like they can't be 100% compliant, then why would they even be motivated to engage in that behavior at all? And that's where a lot of harm reduction communication and a lot of harm reduction practices become important as well, where it's not just yes or no, but it's how can we work with you to facilitate you being able to engage in this behavior at least more than you did before, and to start that process of behavior change. And then that leads to the biggest challenge I feel, and I apologize to the youth of America and Whatcom County. I'm going to speak in broad generalizations right now, and I realize that everyone is an individual. But motivation in disease transmission with COVID is a real challenge with younger people. We've spent a lot of time in the media and in public health telling younger people that they are less at risk. And then through that process and through that communication, whether it be interpersonally or through media, younger people now absolutely believe that they are less at risk for transmission and for serious consequences from COVID-19. And so getting younger people to be motivated to protect themselves is a real challenge now, because the perception is, I'm not going to get it. If I do get it, it won't be that bad. And so we need to figure out how we work within that process and to figure out what type of self-interest motivation that we can key in with younger people that will get them to engage in the behaviors that we want them to engage in. And I know this is going to sound crazy, but through a lot of public health communication research that we've done, health is rarely an effective motivator in behavior change. Just the idea of like, you will be healthier if you do this is rarely the thing that people are going to key in on. I mean, everyone knows that if you eat better, theoretically, you're going to be healthier. But we don't necessarily see that behavior change just from saying, eat better, you'll be healthier. Quit smoking or you're going to get a lung cancer. That is not a motivator for youth. If you look at some of the big anti-smoking campaigns that have focused on youth, they don't focus on health. They focus on anti-big business. They focus on politics and lying and social justice. They're not focused on you as a 16-year-old might get cancer. Because that's an amorphous, theoretical future threat for someone who's 22. It's really hard to key in on something immediate when you're talking about something that people get after 40 years of smoking. So a person might just be like, you know what, I'll quit later. I can deal with that later. And so that's also one of the challenges with COVID that we need to key in is, what is the threat? What is the key to get youth to engage in changing some of these behaviors that are happening in their private lives? And how do we do that? I think that there is some idea that we're getting increasing evidence that there are secondary or possibly chronic impacts, even of mild infections, and talking about that. But I think also we can start looking at what are the consequences in your life immediately if you were to get infected. And I think that that's something that could be a good spot to begin looking at with youth. There are some styles of communication that I think are important. And I think especially important when thinking about your relationship with the people that you're talking about. As employers, you're often not a friend or a family member. And so being able to really engage in like that finger wagging of what you did in your personal life over the weekend can be a tricky situation. And it can get into even kind of some ethical challenges of trying to control what people are doing in their private life. But what you can do is start a conversation about the importance of understanding things. I think education is often not the best way to go. I think most, unless you can hear something that's really specifically your employees are saying that's absolutely incorrect about COVID. But most people are getting the education aspect, and most people are on top of the education around COVID. But it's really about that motivation. Other things to think about, fear and shame have been tried. Fear and shame have been used aggressively the past 6 months. We've done the you're going to get it and you're going to get sick and it's going to be terrible. And we've done the if you don't engage in this behavior, you're a self-centered jerk. Those aren't flying for this population at this point. And so, you know, if you are continuously using the same tactic and you're not reevaluating and changing your tactics, you're setting yourself up for failure. And as with communication with any population, we need to meet that population where they currently are and work with them to move forward. And, you know, your 15 to 25-year-olds don't want to be shamed into behavior by their employers, especially shamed into private behavior by their employers. And so thinking about what are the emotional appeals that you can work with youth, thinking about what are the important things in their life and how are those important things being impacted by COVID. We were having a conversation with Bellingham Schools yesterday and talking about, you know, how students right now are bored. They don't have sports, they don't have school dances, they don't have graduations. You know, think about those emotional motivators to get people to begin engaging in behavior and what people loved and want and no longer have. And how can we get those things back in their life? And so I think generally speaking within our behavior change communications, those are probably kind of the best dangling carrots that we have for us right now with this cohort of people. Now, pass it back to Elizabeth.
Thank you, Steve. That was really good. I felt myself like, oh, that's really good. That's really good. So thank you very much. So we're going to turn to our 4 business leaders or organizational leaders. And we have the questions and you can choose which one you want to lean into. But how do you train and support your young staff to follow the COVID-19 safety practices? Is there anything you would do differently than you would for older adults? Or how do you talk with young employees, just like Steve was saying, about their behavior outside of work and how that could bring it to the workplace, and how do we encourage them to make healthy choices? So whatever part of that really speaks to your experience, we would love to hear from you. So Danielle, if you can start us, that would be awesome.
I'd love to. Thank you. And thank you, Steve. That was really amazing. It was good. I'm going to set a timer so I don't overtalk. So I was home on a Sunday night and I got a call from one of my employees that said that Katie, one of our team members, had gone to the Black Lives Matter protest in Seattle. Darny darn. Like, everything in me supports people's rights to peacefully protest. And I totally understood where she was coming from, but I still had to call her and tell her that she had to quarantine for 2 weeks. Like, she's now financially strapped. I'm now down a team member for 2 weeks. This has been my life for the last 5 months. It is repetitive and constant. And the conversations, I was like, girl, what part of you can't be with more than 5 people don't you understand? Like, we have been over this and over this and over this. And we have to have, regardless of why you're going to be around more than 5 people or whatever the rules happen to be at the time, they have to be consistent for everybody. My name is Danielle Rose Ellison. I'm the CEO of Trailblazin, our campus farm here in Whatcom County. We were established in 2014. We use 100% LED lights, which makes us use about 60% less power than traditional indoor grows. We use 0 pesticides on our products, and we are one of the only farms that is medically certified in Washington State. So with that kind of like socially responsible business plan, we attract a lot of younger generations. That and maybe the fact that working at a cannabis farm sounds super sexy to a 21-year-old plus. We have 25 employees. They range in age from 23 to 69. We have an average age of 32 and a median age of 28. So I am literally surrounded by millennials and a younger staff at all times of the day. I actually went to the team and I said, hey, these are the questions I'm being asked at this presentation. You know, what do you think what do you think works? And here are some of their answers. Bribe us with avocado toast. beat us, maybe more baby monitors to track everywhere, give us time off to get tested, temperature at the door, and my personal favorite was T-Sheets, which if you guys don't know is like a clock-in app that you can use for your employees. It also tracks where they are, where their phone is off the clock. So you always know, I mean, that's some serious big brother stuff that I'm not sure I'm ready to go there yet, but that was their recommendations. You know, how do you train and support a younger staff to follow COVID? I mean, I think it's the same thing you do with any sort of management. It's with consistency and empathy. We always have believed that team members need to feel that they owe us something, not that we owe them something. And so as long as you have that kind of respect and they see that, then that's how you build trust in your upper management. We have clear, repeated, written expectations. And when I say repeated, I mean all the freaking time. It is dumbfounding to me how often you have to say the same thing, but we say it, we put it on boards, we email it, we do it all. We have spies in their midst. You know, our team, they narc on each other when they don't feel safe. So if somebody else is breaking rules, then there are other people here that will report that, because our teams, a lot of them, they live with older family members, right? It's tough to live in Whatcom County on less than 50 grand a year. And most of them are making not anywhere close to that. And so they live with their family members. We've talked a lot about don't kill grandma. You know, our grandma, my mom watches our children. And so if they bring COVID back here, then that is going to negatively affect her ability to watch the kids. We're also small, right? And so if we start losing people, then it affects the entire team here and it creates more stress for everybody. You know, is there anything we do differently with younger people than older people? No, it's basically the same. It's knowing your staff and having them know you and making sure that this is a mutual agreement. We've been watching COVID since early January, where when we started stocking up on supply chain items and PPE and began talking to our team about it. So our general meeting notes go back to January of like, all right, guys, we're paying attention to this and you need to be paying attention to this and things are going to change. So none of it was really a shock to them when we started implementing more things. So I think as an employer, one of the biggest things that we struggle with is communicating that there is a balance between don't come to work sick and don't use COVID as an excuse to go home. Because there is work that needs to get done. And I do not want you here if you have COVID symptoms, but I also don't want you here or not coming to work saying you have COVID symptoms, but you'll be better in 24 hours and you're sure you'll be at work tomorrow. And so it's a really fine line. And it's really kind of comes down to a gut reaction and we are on the side of caution. It's really important that we lead by example, taking this serious from day one, providing different types of masks and face shields. And, you know, some people, you know, if you have glasses, the masks are tougher, so face shields are better. So having all these different opportunities, marking off things on the floor. You know, when we do general meetings now, we used to all get together in a room and now we literally have 5 different departments all from the same warehouse call in so that we can all talk to each other and do it that way. So we take this really seriously in all aspects of Trailblazing. Also, you know, kind of coming back to like empathy, like, can you imagine like you're single, you're in your 20s, you know, you might be living in your van and you're not supposed to hang out with anybody? Like that would be the worst in your 20s. And so really telling them like, guys, ooh, got 1 minute left. Really telling people that, you know, I know this sucks, but under no circumstances should you be at a party with people you don't know. You have to be able to trust other people. You have to be able to know who they are and whatnot. And so, you know, we're not asking you to go to war. We're asking you to like binge Netflix and stay at home. So help a sister out. And then the last kind of thing that I think is really important, like we have a really diverse team in here in regards to ethnicity, gender, sexual orientation, you name it. You know, I've got team members that believe that this is part of the end of days, like the Bible predicted, and I've got team members that believe that this is Bill Gates created, you know, 5G, and they're trying to implement us all with and microchip us all. So we're really not here to discuss why this is happening or where this came from. We are here to provide, we are here to make sure that our employees' health and financial stability is our #1 priority. All the rest of the stuff is just fodder. All we care about is keeping you guys employed, keeping you guys housed, keeping you guys fed, that it's about them and it's about their lives. It's not about our business. It's about making sure that they are taken care of. And as long as we continue to come back to their well-being, things seem to be pretty good. We haven't lost anybody yet. I mean, a couple unemployment people trying to work that system, but it was only 4% of the staff. So I think that's all I got. And then, yeah, thanks.
Danielle, I've heard great things about you, and they are all true. Wow. I just love your approach to all it. What a blessing you are to all your team, I'm sure. Yeah, thank you so much. There's a lot of good stuff in there. Bob Solomon.
Hello.
Hi, I'm so glad you're here. Can you introduce yourself and share? You've been open the whole time, so you have all kinds of experience.
So I'm Bob Solomon. I'm the general manager for the Nooksack Market Center and the gift store at the Northwood Casino. I'm also a tribal council member for the Nooksack tribe. So I have been involved in this from the very beginning, and it was kind of an evolution for us because all of a sudden everybody closed and we really weren't sure what to do except for stay open. We provide services to our community up here with groceries and fuel and stuff, and so we kind of really had to dig into this and figure out how to approach it. And our young employees were amazing. I mean, from the very beginning, it was kind of, we all talked through what things that we were going to do. You know, we had to make sure we had masks in the beginning, but they weren't comfortable. In the beginning, there was such a shortage of things that we tried the different kinds of handmade masks, probably 2 or 3 rounds of those before we finally started getting the paper masks that became a lot easier for them to wear. When our casino opened, when our tribe opened back up, you know, they all opened up with safety plans, and we didn't. So that was a big thing too, is incorporating the things that were safe for the whole community into what we were doing. And so we went out and we had a whole marketing campaign for the mask wearing here at the Market Center. We got pump toppers, we got stickers, we got signage as you walk in the door, and I got t-shirts for my entire staff that basically says, you know, everybody has to wear a mask, and the different kinds of masks between the paper mask, the cloth mask, the scarves, the bandanas, giving people options. It made it kind of fun for the employees. The other thing was getting them to understand the meaning of being sick or just not wanting to work. We had to ask those questions, you know, are you sick or do you just need a day off? Because if you're sick, I need you to go see a doctor. I can't have you around the staff if you're not well enough to work. So we started that line of communication to make sure that they had to know there was a difference, because we needed to know if there's a difference. And so when we started our temperature taking, we started a questionnaire that basically asked them, you know, if you have a cough, or if you've been sick, if you're running a temperature, if you've been around people that have tested positive or have been around people that have COVID. It was really important for us to kind of get them, as they were coming through the door, to kind of identify the situations they've been around. Fortunately, being part of the tribe, I was involved in the governor calls every week and the tribal leader calls every week. So we kind of had that big overhead of what everybody else was doing, and it was really important to what we did and the communications that I had with my staff. I had something on my mind that just went, phew. So we also have a health officer named Frank James, who is amazing. And we have lots and lots of meetings with Frank. And Frank helped us put together a pandemic policy. So if my people decide they're going to go camping and they're around a bunch of people, it's part of a policy that they have to sign off on that says they have to self-report. And what we're asking is that they're off for 5 days, then they test, and then they were able to return after the 7th day. So that's been helpful too for our entire tribe. We've been very fortunate here at Nooksack, and we publicized that in all our communication that we're the only tribe in Washington right now that hasn't had a COVID hasn't had a COVID case. That's a lot. I mean, we've tested 660 some people, and that's pretty amazing. So between the health officers and my daughter sits on the health board. She's one of the gals out there administering tests, Nicole Miller. So she's been great information for me as well. It's just what to look out for and the things I need to prepare myself for with people in our area. And it's been a big help. And my staff has been amazing on grasping all this and wanting to be a part of that perfect test right now. I mean, we're going to get it eventually. We're not going to be able to stay away from it, but it's been a big motivator for my entire staff to thrive, to stay that way. Again, signage, talking to them, making sure that we're doing the testing and making sure that they feel comfortable that they're not going to be penalized is all really, really huge. So that's what I have. Thank you.
Thank you. And I think we all want to cheer for Nooksack. Oh my, what a great accomplishment to not have any. That's amazing. And Rob and I have been on the retail task force together, so it's been fun to watch your journey along the way, and what a great job you've been doing with your team. So thank you very much for being here today, sharing your good words. Yeah. Let's see, we have Trevor up next. Trevor, can you share a little bit about what you've been up to?
Sure. A lot. Actually, I'm really impressed by everybody who spoke before me. Everything you guys are saying is great. And I really actually appreciate a lot of the different perspectives because that helps tie a lot of this stuff together. So my name is Trevor Smith. I am the political director and a business agent for Labor's Local 292. We represent about 1,400 members that work from the King-Snohomish County line all the way up to the Canadian border, with a lot of workers here in Whatcom County. I live here in Bellingham, and I've gotten to participate in the construction side of this task force, and it's been a great learning experience and really, really helpful when dealing with the members and with our contractors. The contractors, just like all businesses, they are attempting desperately to figure out how they can move forward, keep themselves in business, keep their workers safe, keep their customers safe. And it's an ever elusive moving thing. As far as dealing with like the younger members, when everything shut down, we had a whole bunch of folks that were still deemed essential in the very beginning that were doing critical construction projects that didn't stop. And so we went straight to the crew leads and the stewards and the foremans and the companies and started talking about masks and social distance as much as possible. But when you're working on a 10-man concrete construction crew where you are literally hip to hip with everybody else on the crew pouring sidewalks, there's no 6-foot distance in that. So we talked a lot about hygiene. We talked a lot about the overall construction safety culture, which is preached on a very regular basis, because what we do is inherently dangerous. You're either on the receiving end of a car or working with something that is just explosive or just dangerous, depending on where you're at. So building on that safety culture and trying to get folks to understand how this isn't just something that between 7 o'clock in the morning and 5 o'clock in the evening you have to pay attention to. You've got to take this home with you, and you've got to make this relevant to their families. So as far as, do we treat younger workers or younger members different than how we deal with our older workers? Actually, no. We roll it into the overall, this is safety, this is what we're doing, and this is why it is important. I think what we've done differently so far in this is that we address their questions differently. If we've got a worker that's 55, 56 years old, it's a lot about, the vulnerable side of the population, how you don't want to catch something and take it home to your spouse or to your family members. With a lot of our younger members, to be brutally honest, in the very beginning when things did shut down, Netflix and chill led to a lot of people who are now going to become parents. We've seen a lot of folks that, and to be honest, my own daughter is 27 and she is pregnant. I'm going to be a grandfather for the first time in about probably 5 weeks. And that changed a lot of the way these conversations went, because now it's no longer just, don't go hang out with your friends and don't wear masks and don't social distance because you might catch something, but you have a family. You're going to take this home. And that's how we've made this more relevant to them, and not shaming them about it, especially with folks that already had little kids or had early teenagers that are not in school, and the weather is beautiful and the parks are back open and they want to get out of the house. They want to do something, and this is a time when we would normally all be camping or fishing or doing something that was social with all of our friends and family. And a lot of the big parades and events are not happening. So they're kind of recreating some of those things on their own, not shaming them, but telling them and explaining to them why it's important, why being able to come to work and support your family, but also not taking any of this home is the relevant thing. And we have folks that, just like everybody else, that are as far across the political spectrum of beliefs as you can get. And one of the things that we've been doing is not addressing the political side of this, not making this about microchips or it's the worst thing in the world, or whatever it's related to. We're not addressing that. We're just addressing here's the safety measures. This is the best advice we can give you, and this is why it's relevant. And then the whole mask issue for construction, we're somewhat used to wearing masks for certain specific tasks for respiratory protection, but it's not useful for us to wear a half face or a full face mask everywhere we go, from our kitchen to our living rooms or things like that, or in our backyards. So one of the things that we found was really effective was a lot of the folks didn't like the paper masks. It lent an air of they were infectious. They saw it as, I'm not a medical worker, I'm wearing this paper mask. That obviously means there's something wrong. So cloth masks, but with the appropriate media filters in them, and getting all the different kinds that we could, whether it was a scarf, whether it was the neck pull up kind for guys. We got guys with beards that are halfway down their chests, and they couldn't wear specific styles of masks, or even masks like this, and then branding it, right, making it something that was relevant to who they are and what they do, because there's a lot of self-identification around what these folks do for a living. So getting them all the different options and getting the employers on board, and the employers have been great. Most of them, for the most part, they understand that they need to meet the criteria, and they want to stay in business. They want to get their projects completed, because construction happens when the sun is out, not when it's snowing or heavily raining. So they realize that there's weather windows for what they're doing, so they want to stay as productive as possible, and they want these folks to work. So that's kind of been the biggest thing for us, is making sure that this is an all-encompassing thing, but not a shaming thing. But also making sure that they feel comfortable with, okay, maybe they went rafting or something like that with a bunch of friends on a weekend, and now they're sick. Say something, report it, let them know, go get a test. It's a horrible thing. It's a scary thing. We're not going to browbeat you about it. We just want to know so that we can protect everybody else, and that, and we want to get it dealt with, right, is the biggest thing. And we just want to make sure they're safe and they're okay, not turning this into just a complete shame and blame game, and avoiding all of those conversations seems to have made it better. Yeah, that's kind of rambling here, but that's about what I got.
Oh, that was great. And it's so interesting, I think, for all of us to see the different sectors and how it shows up in different industries. So thank you. And most importantly, congratulations, Grandpa. Yeah.
Thank you.
That might have stolen the whole show. So yeah, that was awesome. Thank you.
I'm actually really excited about this.
Yeah. Okay, well, thank you so much. And Janet, we're so happy to have you here. And Boundary Bay is well recognized in the community for all that you've pivoted so beautifully. I'm curious to hear about your employees and how are you handling that communication?
So yeah, this is our 25th year in business, and it was supposed to be our 25th year of giving 25,000 to the community, a year of generosity and giving, and so that was quite a pivot from what we thought our 25th anniversary was going to look like. But I think we began early on, staying in tune with COVID, and did some changes early on with social distancing and changes in the restaurant. And for us, it's like we're deemed essential workers, and yet there's a lot of differences within us as essential workers. So when we went to do the shutdown initially, I'm sorry, I thought I got myself in a quiet spot, but apparently it's going to get noisy here. So we initially did a questionnaire for all of our employees, because we went from about 120 employees to about 24 employees, and that was the initial really huge shutdown that happened. So with the other employees, we put out a questionnaire. It's like, what are your hidden talents? We're not serving guests any longer. And so we did a questionnaire, and it also checked in on how they felt about COVID. So what were their hidden talents? How safe do you feel? What's your living situation like? So we dug in deep early on and found out and personalized how they could help if they wanted to. Unemployment was definitely an option. And for phase one, many were on unemployment. And so we were able to find out, like how comfortable they were, what their living situations were like, and then could kind of fit their needs within our needs. And we got some projects done that we couldn't have gotten done before because we had time and we had these hidden talents that showed up. We also did a lot of COVID training. So when we had people come back to work, and they came back in different waves, and it depended on, we were blessed with some projects such as feeding the hospital one day. So we needed to bring in a lot of staff to feed the hospital. But we did a lot of training. We had a COVID manager on site, and we did a lot of just very obvious, this is where you come in. You're not just going to use any door. This is the door you all come in. This is the checklist that you, by clocking in, you have agreed to these number of things. There were boxes of gloves. There were masks. There was hand sanitizer. It was very demonstrative of how important it was. And we just continued we had a safe break room for our staff to go in. Everything was sanitized. It was just, we gave it such importance, and we put in so much time and education into our staff. And we have 17-year-olds up into 70-year-olds that work here for us. And so that median age for us is definitely in their 20s. But we got a lot of buy-in early on through the educational component of this training that I think really benefited us. And the other part of it, I think that really benefited us, is that essential workers in a restaurant, you are social. So the people that wanted to come to work kind of got that itch scratched by coming to work. So now you've got co-workers that you've hung out with for years, and so I think there is a lot of social benefit for our employees. That emotional, psychological need to hang with people it's kind of, that box is checked here just by coming to work at Boundary, and knowing that the consequence if they leave Boundary and they go and party in a place that maybe it's not going to have that door that you walk in, it's not going to have that hand sanitizer and that mask and those gloves. And so by knowing that they're coming here and they're getting to have that social interaction safely, and they know they get to come back again and do it, the next day, and they're getting paid. All of these, they're getting to eat boundary food. It's just that normalcy that is lacking so many places in our lives. We can provide that for our employees, and they know if they go and they go party, that they're not only risking that sense of normalcy and that social benefit, financial benefit for them, but for all the others. And I really think we got some really deep early buy-in with our commitment to their safety and how we were committed to our community as always to keep our community safe and how we're going to serve safely. I think for us, it's easier because we offer a social setting. And if I had employees that are stuck in an office, and I that empathy would have to go so deep to keep them from going out. But as an essential worker that gets to interface with the community, I really feel like it's easier for us, but it's very critical because we do engage with the community that each of our employees takes it very seriously. There's a lot of testing. If there's a sniffle, I get a call. I'm going to go test. I'm going to quarantine. There's a lot, and it's all very, very self-engaging. They're being very responsible about it. Employee says, my roommates are going to have a party. They don't work at Boundary. They're going to go to a party. What do I do? Talk about it. What is your living situation like? How can you quarantine? How far away do your parents live? Can you go and live with, can you go there? And again, testing has been very, very beneficial and easy for our staff. If they feel like there's been a breach of any of those safety COVID measures that we have, they're immediately going and testing, and we're able to cover and move on. So it's been, really a combination of commitment and education, and we're back at work and we're enjoying each other's company again. And just that is such a blessing, and we don't want to lose that. So that's kind of, I think, been our keys to success so far.
Amazing. Thank you, Janet. It's interesting to think of the culture you've created over the years, and you've just amplified it even more during this time, and how much it's paying off for your organization. Like, that's such a gift that you've really leaned into. Yeah.
Yeah.
So,
thank you. Yeah.
Thank you. Wow, that is a lot of great information. I'm so curious where the questions are today, and there was so much. So does anybody have, and we also have Cindy, as you remember, I'll stop referring to you as the queen. That's the last time I'll do it today. Cindy with us as well. I'm curious what questions are showing up for you today, of each other or of the guest. You can raise your hand up or throw them in the chat, either way. Holly, did I see? Did you have a question, Holly?
Oh, me? Yeah, I have a question for sure.
Great.
But I'm supposed to wait for others, but I'll jump in. Hey, first of all, I wanted to say to Janet, your leadership in the community has just been such a blessing for so many years. And also, if you have a copy of that first survey, that would be really fun to see, because it really changed my thinking about how, supporting our employees and how that conversation plays out. But actually, my question is for Robert. Hi, Robert. Hi, neighbor. I have a question for you.
Okay.
And so one of the kids who I saw born was working over at the market. She got exposed and was tested positive for COVID. And what I noticed in the community was, because we're part of the whole social network out here, was sort of this sense of embarrassment and shame. Like, she didn't want to tell anybody that she tested positive. This is within like our social community, right?
Mm-hmm.
Her parents didn't want to tell anyone she tested positive. She did, her housemate did, her husband did.
Yep.
And I was just really curious, like, what was your experience in it at the employer side, like in terms of, I don't know, this sort of like shame or embarrassment harassment around, oh no, so-and-so, like, did that exist for it within the workplace? Because we had to work hard to say,
Absolutely
no,
not.
it's okay, it happens, you know, like,
No,
I'm on
absolutely
the
not.
outside. Yeah, how is it on the
Yeah,
inside?
when that happened, she had been off for a week before that because she thought she had been exposed.
Yeah.
So she hadn't been to work in over a week. She came back to work, and she was here for 2.5 hours. And she had her masks on. She'd had her gloves on. Everybody in the store had, and so basically she went out to take her first break and then found out that her roommate was sick.
Yeah.
So immediately we just sent her home, made sure we called our health officer and asked how to deal with it. And so we made sure we did the things that he recommended, which is basically clean everything up really good and make sure that she goes home and takes care of herself. And then unfortunately, once she got better, because it went through her whole household, by then she was just on the verge of getting on with a union job, so she never came back. But she was a heck of a worker, and we miss her. And there was absolutely no shaming at all.
Cool.
She was very self-conscious, and she did everything she could to help protect the entire staff around her.
Yeah, she's a good kid.
She is a good kid.
Yeah.
Very good kid. Amazing young lady.
Yeah.
So, yeah, no, there's no self-shaming at all. There's none of that. It's if any one of us can be exposed at any time. It's up to us to make sure we're very supportive and we take care of our employees and we take care of customers.
Any other people have questions? That was mine, but I'm super curious what other or experiences that people have had in that same conversation about talking to young people, what you've found or experienced. Younger.
I have a question.
Yeah.
So a lot of some of the attitudes can be pretty negative, just about, is this even a real thing? You know, and I don't know if that's coming from their parents or what have you, but I guess I'm curious how you approach conversations with someone that maybe has that negative attitude about it, and you need to be able to turn it around in order to get them to take the steps that we need them to take.
I'll jump in here if you need me to. I mean, I think we talked a lot about it, you know, as this level of, it doesn't matter where it comes from. It doesn't matter. Whatever feelings you have about the situation we're in is yours to have, and I honor that. But here we have to be cautionary and protective of our team, of their families, and from liability. Right? So it's okay that you don't like it or don't believe in it or whatever, but we have to take this stance to maintain your health, your safety, and our financial stability. And if they don't honor that, there's nothing I can do.
Yeah, I agree with that. We offer them a job, and they have to be able to do the things that are asked of them. And it's not being asked of them because we're picking on them. It's the safest thing to do for all of us right now. I ran into this a couple of weeks ago with an employee who refused to wear her mask the right way. And then it was my first day of vacation. I wasn't here, and I get a phone call, and I'm on the speakerphone with her and the supervisor, and she's adamant that she doesn't need to wear the mask the way that she's supposed to wear the mask. And you know, you give her options. You know, if you're going to be here, we have to have you wearing the mask the proper way. And if you choose not to, then we can't have you here. So that was her last day here, unfortunately, but she wasn't going to be able to put a negative spin on everything that we had worked hard to create at the store here. So it was just better to let her go at that point, and the choice was all hers. But we got rid of the negativity with it.
I think when you provide options like that, you know, we do a 3-strike rule that if we see you not wearing your mask correctly, we'll up to 3 strikes. And after the 3rd strike, you have to wear a face shield. that is now your option. You know, if you don't want to get COVID tested, then that's okay. I either need a letter from your doctor saying that you've been examined and it's safe to come back to work, or I need you to 2-week quarantine. Any of these choices are totally up to you, but this is our policy.
Yep.
I know that we've been addressing a lot of that because we get that with construction workers. Some they don't want to comply. I mean, and when it's 80, 90 degrees outside and you're sweating, nobody wants to wear a mask. So I mean, we get everything from the I think I had this in March already and I'm better. Not that I ever got tested. To it's all made up, or you know, whatever. And mostly the way that we generally address that is we try to de-escalate it without making it worse, right? Well, look, here's the deal. The rules are, in order for your employer to keep you employed, you have to follow these rules. It's not your employer's fault. It's not our fault. It's not anybody's fault, but this is the reality. So let's just do this and let's all just go to work. Let's get home. Let's keep ourselves safe, keep our families safe. And that is not, it is not a miracle bullet that kills this conversation, but it at least ameliorates it long enough that we can usually get through the day, and then social pressure from the rest of everybody doing it tends to mostly make it better. We're not going to change anybody's minds at this point. If they believe this is a hoax, they believe it's a hoax, and there's nothing I can do about that. As far as our members, it's our job to keep them gainfully employed, and to make sure they're as safe as possible. So that's kind of where we try to focus this at.
Yeah, I think to add on what everyone said, whether or not someone believes it's real, your structures at work are real. And so I think that's a way to focus on it. It's like, you might not believe COVID is real, but the 2 weeks you're not allowed to work after you get exposed are real. So you can decide what you want to believe in that respect. And so I think that, you know, making things applicable and direct without kind of the judgment around it is helpful, while at the same time, as a leader, building a culture in your workplace that acknowledges the reality of the COVID-19 situation. I think sometimes, you know, people can have their individual beliefs about it, but as a leader within your organization, it's important to stick to kind of the factual evidence that's being presented. And over time, as Trevor pointed out, it will eventually normalize. You're always going to have people on a fringe of anything that are going to have their own beliefs, but the idea is that the vast majority of people know that COVID is real. And the more that we acknowledge the fact that it is real and that the vast majority of people believe it's real, you know, the drive of the naysayers begins to decrease over time. And especially with younger people, oftentimes they're repeating what they're hearing from friends or from family members. And so you also might be one of the few sources they have outside of friend cohorts and family cohorts that's giving them information where you're someone that they'll listen to. So, you know, you don't need to aggressively change people's beliefs, but just creating a culture that accepts the reality of the situation can be really helpful.
Can I add one more thing onto that? I think that's what Steve is saying is, and we've all kind of said it, but I think that is a really important point. There's so many aggressive, loud voices on both sides of this argument. By not being that loud, aggressive voice, but being calm and reasonable, but firm in this is what we have to do to get through this, makes you more approachable and somebody that when they do have questions, at least in my personal experience and in my coworkers' personal experiences, that makes us somebody that they will go to and ask questions of, rather than believing the really loud voices.
I have at my fingertips several research articles that prove the effectiveness of masks, so that when we have these conversations, I'm like, here's some data and some research, you know, look at who's doing these studies. Are they privately funded? Are they publicly funded? Like, let's look at this bigger picture. And if you have something to counter that, I'd love to see your information as well.
Nice. I have another question for the panelists. Ready? And here it is. One of the conversations that's been happening in a couple of the sector groups that we've been working with on the task force has been, how do you manage break times? So you've got your staff in masks. It's a long day for some of them to be working in masks. What do you tell them, or how do you, what are you saying for breaks? I'd love to hear from all of you.
They're the bane of my existence. People have to stay on time. They're all separated. It starts when it starts. It ends when it ends. If you go to break late, it's still at the same time, and there's 5 minutes in between. And it is a constant issue here. But yeah, you schedule them all 5 minutes apart, and hopefully you can get through all the departments in one day.
With us in construction, it's a little more fluid situation depending on where you're at, whether you're in a refinery where you have a defined break room or a break trailer. For that, the conversation is the break is the break. Everybody stays 6 feet apart, whether you have to move tables, put chairs in between people, whatever it is. And then cleanliness and hygiene, which we're all generally used to in a fixed location like a refinery with a break room. Hygiene is a huge thing all the time. So increasing that has been relatively easy. Getting people to not huddle up on one end of a trailer where they all want to talk or something like that, that's kind of the hard part. So that's kind of a social engineering kind of a thing. On a road crew where everybody is generally moving and you're in and out of like trucks or equipment or something like that, it's been a little more complicated, but people naturally tend to stand further apart. So we just make sure that we talk a lot about the staying 6 feet apart when you're taking your mask off so that you can eat your sandwich or whatever it is you're doing or drinking your water. And then going back to the hygiene part of it, make sure you're cleaning out, the cabs of your equipment every day at least, if not multiple times, or when you're done with that piece of equipment, wipe it down. And making sure that people understand that isn't just protecting them, that's protecting the people that they work with every day so that they're not passing something between them. And that seems to be working. Complacency is a killer at this point. People get tired of doing it. They think this has been going on for months. They've already survived this long. So reinforcing that, and that's what we've been doing with the companies and with the stewards and the foremen.
So mine is more of a comment rather than a question. But first thing I think we need to communicate to everyone, but especially to the younger generation, is number one, kind of setting up the right expectation. This is not a one point in time, one disaster. Sterling was talking about that last week. There's not the natural curve of what happens in a disaster. This is this is going to go on, and we don't know how long it's going to go on. We will figure out how to deal with it. So, there's not it's like, it's going to get better in 3 months. It's not, we can't, we have to set up the expectation in a realistic way, number one. And number two, I think it's very important for us, especially, the employers who have a lot of younger people working as employees, to be authentic and honest. And the fact is, none of us, authorities, scientists, doctors, government, none of us really know this. It's like we're reading a mystery and we're only gotten through 1/3 of the chapter. We don't really know. We think, this might be the suspect, this might be the guilty person, but we could only guess. So we have to be honest to, especially the younger generation. They see through us. They know when we're kind of putting up a bravado or pretending like we know what we don't know. So we need to just say, a lot of things have changed. The recommendations have changed because we just don't know everything. But we are telling you this is the best we know. So when you're communicating with them, I think if you come from that place of authenticity and complete honesty, I think they will be more likely to accept and follow through. And that kind of goes back to that, I think, motivation. We don't want to guilt them. We don't want to, hang this and this and that over them. But I think if we are honest and just say, this is what we know now. I know things have changed. And honestly, things have changed so much. It's kind of, you know, I'm getting a whiplash from just, you know, this and that. And I mean, right. And I feel like I probably know a little bit more than an 18-year-old, but imagine 18 years old and like what
We may have lost Gina.
Yeah.
Oh, there she is.
Oh, there she is. She's back.
You got frozen for a little while. Yeah.
I wanted to add one thing, and this is splitting hairs just in communication, and this is very opinion based. It's a phrase that I used a lot and I've now moved away from. But you hear the phrase, the new normal, this is the new normal, being tossed around a lot. This is a personal opinion. I've decided that this is a terrible phrase to use with young people especially, because it's not normal. And I think that we can acknowledge that. And I worry that sometimes when we tell people, well, this is just the new normal, like jump into it, that it erases the emotional experience that people are going through in trying to apply some of these things in their life. And I think it's fair to say, like, this is our reality, even though, you know, it's not normal, but this is just the reality of the situation. But we can acknowledge that, like, having to stand 6 to 10 feet away from every other human being that doesn't live in our household and wear a mask and not be able to be with groups, we can acknowledge that that is not normal. And I think that that's a really important thing for us to acknowledge when we're communicating with people, but at the same time, acknowledging that that is now our reality. And I think that, you know, it's a little bit of splitting hairs within communication, and it's, maybe this is my own emotional journey dealing with, but I found that for me, it's important.
It's thought-provoking.
Mm-hmm.
Yeah.
Well, it doesn't, when someone says new normal, it makes you almost want to protest against it. Because it's like, well, that's not the normal I want to accept. So I like that pivot. Mm-hmm. Yeah.
Cindy, do you have anything you want to add from either what we've seen in testing or contract tracing and generalities that you can speak to us about from the health department?
Yeah, well, thank you all for all the great work you're doing with your employees, with your businesses, and demonstrating to the community your belief in some basic disease transmission principles. So that's great. I think generally, you know, early on in the pandemic, we saw such huge transmission in our nursing homes. It was in our older adults. It was so alarming. And, you know, we felt now that seems to be really, they're doing a great job with universal masking in the facilities and really good infection prevention. And I think I saw one of our long-term care administrators on board too, but I think they also, this is another group where a lot of younger employees that are out and about socializing. And so difficult messages. So anyway, we're actually, I guess the other thing I wanted to say about, so older adults earlier on, and now we're seeing, of course, the younger adults, the 16 to 40-year-olds, increased transmission. The one thing I have been noticing, we have a outbreak meeting daily where we talk about what's happening with our outbreak, hopefully not going to be an outbreak, but businesses that have employees that are positive, and how we're supporting them and making sure that the employers got what they need to make decisions about the workplace, and if the employee was infectious while they're at work. So we're seeing actually very little transmission within the workplace, unless there's some, I don't know if I'll call it violation, but not adhering to standards that we know are the best standards. You know, it's when there was the break rooms weren't adhered to, or the other one that's really tricky is when it's really small spaces and distancing is not easy to do. So there could, you know, thinking about practices too, you guys just talked about some really great practices all the way around, you know, everything from you know, the support and not shaming all the way, you know, to the whole end of the spectrum. So given that, the other one thing I didn't hear talked about also was cohorting of employees. I think that's important when you are in a, maybe somewhere where you're doing a lot of shift work. I know in restaurants, a lot of times you come in for, schedules are kind of all over the place. And so getting people scheduled as cohorts can be really helpful too. Then just that cohort can be put and taken to quarantine if that's what needs to happen. So don't forget, you can take a look at our website. We just did some new data charts that went up yesterday. I'm kind of looking through them right now. We have been doing the data by school district, and now there's some updated graphs over time, so you can see how things have ebbed and flowed around the county since March. So so do you guys, anyone have specific questions for me? I'm going to put the link to our
Great.
to our website right here in the chat box too.
Thanks.
Cindy, I do have a question.
Yes.
I get a lot of I get a lot of questions from people like, what about those kids in Blowdale Park?
Mm-hmm. Yeah, what about that? Yeah. Steve's probably got the better lens on the behavioral change part. I think the other thing that, well, you know, we have seen, I think it started maybe Mother's Day weekend when families were starting to gather, large family groups gathering, and the sharing of food and close connections, you know, even though it would be outside in a park, we did see some instances of transmission there. So I think it's, you know, if you, I'm not going to, one thing is if you're not comfortable, you shouldn't go there. I think everyone on the call has demonstrated some really good messaging to their employees individually about what are some practices that they'd like to see their your employees doing. The other thing that's occurred even in my own family is this kind of altruism, which I didn't think was there. Like, I don't want to be the one that would get somebody else sick. So even though I know I might not get very sick, I don't want to be the one to get it because I was hanging out with my friends and then go see grandma and grandpa. I could never forgive myself if I gave my grandparents COVID. So that was something I heard my daughter, who's 26, say. So that felt reassuring to know that she's keeping her circle small, keeping the bubble. I guess the other thing is, like, maybe it's that time for that message about picking your friends wisely. Hang out with the people you really like. Maybe there's 5 of them. So.
Yeah, I think my students at one point were talking about like picking their cohort family or their COVID family. Like they're like, you know, and it's kind of that harm reduction philosophy. They were like, look, I know I'm not going to sit by myself for 6 months. Like, it's not realistic. And then, you know, you're going to fail and give up. And there's all the emotional consequences of failure. But they're like, but I think I can make it if I have like 5 people I can see and be a human being with. And that's the thing too. And that's also where kind of that macro public health messaging is. We've been like, go outside. So everyone
So they're
went
all
outside. And then we're like, no, not like that. And so, yeah. And it's about kind of, as Tina was pointing out, that constant evolving messaging and understanding and trying to work with people where they're at. People want to get outside. You know, we're in Washington. We got like 2 months to get outside. And so and there's ways that you can do it and be, you know, generally fine doing it. It's just about sure that you build your bubble, go outside, don't get in other people's space. And it's figuring out that harm reduction messaging. Like, yes, go outside. Yes, you know, see people in certain ways and like figure out how to do it. You know, even in my own family, like I have 2 3.5-year-olds that are, you know, in a house with us, and we're having conversations now about like what kind of activities can we do with them, and even trying to figure out how to support businesses that are trying to do things the correct way, where we might be able to get our kids out where we won't be around anyone. And we're having conversations about even going down to Seattle to go to the zoo. because the zoo is all outdoors and they're only allowing now certain amounts of people in at certain times, and you schedule appointments, and trying to figure out for our family what is that kind of way that we can engage with life while still reducing risk and harm, and realizing that you don't have to sit in your bedroom by yourself for a year, but you need to understand how you can protect yourself and how you can protect others and have those conversations about nuance.
This is all hard. Me and my wife have 7 kids, and we have 12 grandchildren, and between our step grandchildren and our grandchildren, I think we have 16. So we haven't been able to have family gatherings just because there's 30 some of us. And so all of us in one spot isn't healthy. We've done Zoom birthday parties. We've done some creative things. Easter, me and my wife went out and just drove to all the kids' houses and dropped off Easter bags. But it's difficult. I mean, especially when you're used to big family gatherings for every reason possible. It's not easy for us to get through.
I will say that the younger generation, especially like my daughter being like 27, right? Their connection with technology with their friends is far superior to my age group in my early 40s, and my folks. One of the things, I mean, it was funny because I mean we're all on Zoom calls all the time for work and stuff like that. Mother's Day, like Cindy was talking about earlier. I was sitting around my living room with my daughter and my son-in-law, and I was lamenting the fact that I could not go a couple states away and see my mom, right? I could call her, just not the same, right? And my daughter looks at me and she says, you set up Zoom calls all day long. Why can't you do a Zoom call with all of your siblings and your mom? And we did. First time we've ever done it. Walking my almost 70-year-old mother through downloading a Zoom app on a tablet, that was a whole new experience. But it worked. And now, in some ways, I think we're almost more connected than we ever have been because all of us siblings are spread across the country, and we actually talk on Zoom or on other social media connections. And that's something that several of our members have talked about, is about how they're starting to do more stuff independently outdoors with just their spouses or their kids or whatever, but they're using electronic media or some sort of apps or something to real time talk to their friends that are doing it somewhere else away from them. And it was an interesting thing that I hadn't really thought of as far as people connecting without actually being physically present. So there may be something I think we can all learn from the younger generation that is more connected than we are.
My family actually hired, so my extended family that is in California, Texas, Washington, elsewhere, actually hired a magician to do like an hour-long show over Zoom with our entire family, like attending the Zoom at like a Friday night happy hour. And so, there's creative ways to engage with each other. But as Bob pointed out, it's not easy, and it is different. But yeah, that was one of the interesting experiences that we had.
Other questions or thoughts to share with each other today? We've covered a lot of material. I love it. Elke.
Hi. There's been some chaos in the office, so I've been dark here. I just had a quick question. I don't know if this is maybe a Trevor question, or Danielle, you seem to have some great insights, but we had a younger team member who quickly responded to the mask thing with, I have a medical condition. And we weren't sure. We did have a conversation with him and said, well, if that's really the case, we would need a doctor's note, but I'm curious if we need written policies to back up this, and do we need to quickly create a policy? Like we're a new business, so we don't really have a great policy manual at all, which it's on the list, but so I'm just curious if you guys have any insight on how much would we really want to document in writing, or need to get a true policy and written policy in place for some of this stuff as rules change and we're navigating.
So I actually ran across this just recently with a employee who, again, was refusing to wear the mask correctly. She went to the doctor. For some reason, the doctor said that she couldn't work wearing a mask. And You know, we have 1,200-1,300 customers a day. That, to me, that doesn't seem like it's a healthy place for her to be anyways. So we basically had to retain her as an employee, but put her on unpaid leave until either she's able to work again or until this is all over with, which could be a while. But it's not a safe place if they can't wear a mask. It's not safe for them. It's not safe for the customers.
We've had a couple different experiences with that, with members that couldn't wear a mask or didn't want to wear a mask, and the employers have asked for a medical note or something like that from a doctor stating what it is. But most of them have either have basically, and we've been kind of standing behind the employers, saying that, well, either you have to comply with one of the means of protecting you and those around you, or yeah, you're going to be either on leave or laid off or something like that. Not as a threat, but as a we have to comply and we have to keep everybody safe. If you have the medical note, I mean, we've worked with some of the contractors about moving people around, trying to move them to more isolated places where they're not going to have to interact, and maybe they can, if they can be in open air and more than 6 to 10 feet away from somebody, then I guess they could take their mask off. But for construction, the guidelines say you have to be masked pretty much all the time. So that's a requirement for the job to work. So it's been a really case by case, hit and miss. And I don't think anybody has nobody came into this with a policy manual in place that said that if you can't wear a mask, this is the company policy. Oddly, nobody was prepared for that. So we've all been kind of ad hocing it as we go.
So one of my best friends is a doctor, and a gal called her and said, oh, I need to come in for an appointment and I have a medical condition, so I don't have to wear a mask. And my girlfriend was like, what medical condition is that? Like, the woman had literally said this line so many times that she didn't realize saying it to her doctor was not going to fly. Right. So just real fast, the written policy, first of all, congratulations on starting a new business. What a interesting time to do that, right? It's like timing. Written policy can really be emails to the staff, right? So this is where we're at right now. This is what we're doing. It doesn't have to be like a totally official handbook, especially because it changes so often right now. And so just sending up those updated emails that say, this is where we're at, this is what we're doing, this is what's expected. And then as those things come into place, then you can add to that and say, hey, just a reminder, we're updating this a little bit to let you know that this is required, or we need a doctor's note, or, you know, because things will come up where you're like, that's fishy, something's fishy. So now it needs to be, because a doctor's note, if you have a good relationship with your doctor, they'll just write you one, right? If you don't have a good relationship with your doctor, that's a little bit more difficult to come by. How to be able to use that. And then just for your information, the SBDC has a great employee handbook that's generic, and you just fill it all in, and it's everything that you didn't know you had to know about. So yeah, that's all I got.
I also wanted to add, I think that you hear a lot about the people using the ADA, saying like, you can't make me wear a mask because the ADA will protect me. But I wanted to just, I'm not a legal representative, but make sure you do research, because the ADA has come out a couple of times already and said that they do not actually have any blanket policies about masks, and that currently under COVID-19, the ADA does actually have exemptions for things where there's a direct threat to health and safety. And COVID-19 often falls under that situation. And the ADA also doesn't claim that a person is allowed to do absolutely everything that everyone else with a mask is doing, simply that, you know, reasonable exemptions or reasonable accommodations can be made for people. So, you know, I think sometimes there's those fake cards that were going around and things like that, but the ADA has made multiple clarifications about that as well.
Also, what are the other options, like face shields, right? Like there's other things that we can use in order to accommodate these people's needs, but just saying, no, I'm not gonna, is not gonna fly from a business.
Well, just as a physician, even if my best patient came and told me that she or he needed a note like that, number one, I would like to think that none of the doctors will ever do that. However, there are people who actually are struggling, or they don't really understand our making these requests. As a physician, we will inform them of the real danger. They will get, they will be educated, and they will be given options like, these are the things that you can do. If you really, really can't tolerate it, then these are the things that you can do. Move outside, face shield, you can have those gaiters instead of a mask. So if they were really truly trying to get a no from a physician will have a long conversation. So that's actually not a bad thing.
Thanks.
And Holly, I'm just noticing our time, we're up at 11:30. So if it's okay to wrap up our question and answer section. And Holly, if you'd like to share about the next forum we have scheduled.
Yeah, I will. Thank you all.
Yeah.
This conversation leads itself perfectly to really what's going to be the wrap up of the Employer Supports Task Force, in this chapter of evolution. And it has a lot to do with sharing resources. So these last conversations about what policies are you using and what masks are you using or whatever, one of the things that we're hoping to be able to continue is to be able to share these tips and tools and sample plans as we move along and as they get updated. So the next event that we're going to be having is happening on Thursday, August 13th, 12 noon to 1 o'clock. We don't have it yet set up on the whatcomtogether.org. We don't have the registration set up, but I'd encourage you to mark your calendar and at least join us for as much of this as you can, because I think it's going to be really fascinating to see. We had, I remember, 140 members of this task force, and people who've been sharing just great tools and information. So I hope you all can join us for that. And again, I just want to thank everybody for being here. I especially want to do a shout out to Steve Bennett and especially to China, because they have spent endless hours as members of our Public Health Advisory Board helping lead this process forward so that we can have these conversations. And to everybody at the health department again, because it's the only way we're going to make it through with any degree of sanity is if we are able to talk to each other, get down to it, and come together in this time. So I just want to thank you all for being here, and I hope you have a great weekend.
Thanks, everyone.